Welcome back to Wake Up America. Depression is growing at an alarming rate in our country, with now 29% of U.S. adults saying they've been diagnosed with depression at some point in their lifetime. Now, that's 10% more than back in 2015, with women and young adults experiencing the greatest increases. And joining us now for more on the latest statistics and what may be behind them, let's welcome in board-certified clinical psychologist and associate professor at Touro College of Osteopathic Medicine, Dr. Jeffrey Gardere, and here in studio, licensed psychologist and certified elite personal trainer, founder of the Metamorphosis Center for Psychological and Physical Change, which treats children, adolescents, adults, and families. Dr. Renee Exelbert, thank you so much, both for you to joining us. Dr. Exelbert, I want to start with you. What do you make of these latest findings?
Well, 1 out of every 6 adults is depressed. We have unprecedented emergency room visits for children and adolescents for psychiatric reasons, and 1 out of every 4 Gen Zs report depression. So we have what's called a cascade of collective trauma. We're coming off of COVID, where there's been incredible isolation and loneliness. We have mass shootings. We have an epidemic in terms of obesity, which is correlated with this inflammation from food, which causes mental health issues as well. So we have so many things going on right now, which all correlate with this depression.
Yeah, it's really sad, because we've talked about kids, but now we're hearing, adults and women that it's affecting. Dr. Gardere, some of these numbers are staggering. So with nearly 3 in every 10 adults clinically diagnosed with depression at some point in their lifetime, that's nearly 30%. Now, we know, as Dr. Exelbert said, this pandemic, it took a huge toll on us. We've also talked a lot about what's done to America's younger population. They were out of school. Social media obviously could play a big part in this, but what do you think is behind this jump in adults? Do you think it's that more people are talking about it because it's okay now to say, look, I have anxiety, I have depression? What do you think is behind all of this?
Well, I think Renee is absolutely right in every point that she made. But we also know that, yes, people are better educated about mental health. They're able to identify that they have depression and anxiety. But the issue that we're running into, Allison, is that 11% of adults with mental illness are uninsured. 28% are not able to get care, and we see that there are supply chain issues with regard to psychiatric medications, and we know that there is a lack of mental health practitioners in this country. Even many of the medical schools are looking to diversify, get more people into their ranks in order to fill in those gaping holes with regard to meeting the psychiatric needs of adults and adolescents.
That's a great point, because I know after COVID, I had talked to some therapists and they were so overwhelmed. They weren't taking any more patients. So it was really difficult to even find a therapist available, to take, an adult or child. Dr. Exelbert, Gallup found depression rates, they're rising fastest among young adults, women, Blacks, and Hispanics. Why these particular groups?
Well, young adults, we're talking obviously about social media, isolation, but in terms of Blacks and Latinos, we're actually now seeing rates higher than for white individuals. I think part of this is that we're seeing a greater representation, finally, for mental health practitioners from diverse backgrounds. Unfortunately, people, really don't want to see somebody, well, not unfortunately, but people don't want to see somebody that is so different from them. They really want to feel understood, and so cultural aspects are really important. And so we're trying to start to pay much more attention to that.
Yeah, and also to Dr. Gardere's point, a lot of people aren't insured or can't afford it. Even if you are insured, though, I mean, the co-payments could be, $50 to $70, and if you're supposed to go once or twice a week, that's a lot of money, especially, when we're dealing with the economy that we're in. Dr. Gardere, this has been making news. Montana has become the first state in the U.S. to completely ban TikTok after the state's governor signed a measure to put a stop to the social media app. So we've talked about how dangerous social media is for our younger generations. Do you think that this is a good idea? Do you think maybe this will help, steer kids away from anxiety, depression?
Well, we certainly have seen that social media really has impacted the health of young people, trying to keep up with their peers, making sure that they are very similar and trying to keep up their social status. So I really do believe one of the things that we need to do more and more is to regulate that particular industry and make sure as parents that we are in charge of what it is is that our children are seeing, how they are interacting. Dr. Vivek Murthy, the Surgeon General, said that we have an epidemic of loneliness in this country. And a lot of that is tied into us being too tied into virtual reality and not the reality of in-person contacts.
Yeah, agree. And I think, we go on social media all the time, even adults, and you compare yourself. You think this person has a better life than you. You feel isolated. But Dr. Exelbert, what can we do? Or what do you have of tips if somebody is anxious or they are feeling depressed?
I think, first of all, we definitely want to pay attention to the suicide hotline, which is 988, very easy number to remember. But in terms of depression, if somebody is really depressed, we want to see that on a continuum. If they are barely getting out of bed, we want to focus on one goal-directed activity a day. If it's just getting out of bed, that's great. If it's making your bed, if it's making a meal, if it's getting out, we also want to focus on mental hygiene. We know that sleep is really, really important for depression. So getting out every day in sunlight, if you're able to exercise, if you're able to clean up your diet, because as I said, it's very tied into mental health, and always seek out support. We have apps on our phone in terms of reaching out for therapy. So just getting social support.
You're right. That is the one good thing that came out of COVID is remote. So if you can't find a therapist in your area, you can't have time to go and see them, you can do it remote. Dr. Exelbert, Dr. Gardere, thank you so much for your insight. Great to have you.
Thank you.
Thank you.
Of course.